Thank you very much for the opportunity to speak today. It's really invigorating to come to meetings like this and think about collectively solving these problems, and I'll say more in a minute. Generally speaking, when NIH thinks about these things, we think about how do changes in the culture or policy ultimately fulfill our mission, which is about bringing the fruits of science to the bedside and improving the health of humans and advancing medicine. And so a lot of this, from our point of view, gets implemented through the science that we fund. And we like to think that these tools of transparency, and I'm going to talk a lot about sort of what the tools of transparency mean, are really an essential component of science. And I think this is really critical to think about, because one of the barriers that I certainly see from where I sit sometimes is that when we talk about everything from rigor to transparency, they are occasionally spoken of not as part of the fabric of good science, but in fact being in opposition to good science. So, well, we could spend more resources on ensuring rigor or ensuring transparency, but then that's less money we're going to have to spend on research. Well, I would argue that, in fact, all of that money is being spent on research, and better to spend it on high-quality research than throwing good money after bad, as they say. So I'm not going to spend a lot of time dwelling on this, because I feel quite certain I would be preaching to the converted in this room. But transparency matters to all of the stakeholders in this enterprise that we've built. Certainly for scientists, for the public, which is particularly true when you are a publicly funded research agency. You have an ethical obligation to make sure that the public's money is well spent, that taxpayer dollars are subject to good stewardship, and that at the end of the day, we have accountability to the public, and transparency is certainly a tool for building that trust in that space. And then, of course, we think a lot about research participants too, the humans who are volunteering their time and bodies for the research that we fund. And we think that transparency is incredibly important to fulfill the ethical mandates of that partnership as well. So a lot of what we're talking about today, of course, are incentives and disincentives. I sometimes like to joke that NIH operates under the golden rule. We have the gold, so we get to make the rules. We've got 40 billion carrots and a really big stick. And so that's a heady place to be from my point of view as sort of the chief policy wonk at NIH, because like many folks in policy, I got into this business because I'm someone who's out to change the world, to make it a better place, right? And so my small piece of the pond is making the scientific enterprise a better place. And so I spend a lot of my time thinking about those carrots and those sticks and how we use them thoughtfully to improve the entire enterprise and do the right thing. So I love meetings like this, because they're ready. I leave thinking, okay, I'm ready to take up my my pitchfork and my torch and march out there. But I think it's also important to think very thoughtfully about some of the cultural aspects and barriers and how we address them collectively. So from where I sit and look out across this ecosystem, I like to think a lot about kind of the root cause analysis. What are the problems that we're trying to solve? And I think in this space, there are some big philosophical sort of cultural problems that we need to think about. Number one is we take it for granted quite frequently that scientists know how to do science and are good at doing science, and that they're equally good at training others how to do science. I mean, this is the fundamental kind of basis of our entire system. Truthfully, as I think you've heard a great deal of evidence already just on this panel alone, there's a lot of reasons to suspect that might not be true. And so, okay, we've recognized that problem. How do we fix it? Because it is very much the foundation of this enterprise that we've put forward. And again, I think, my own sort of perhaps self-pitying plea in thinking about this ecosystem approach, because I strongly endorse what Brian was saying, that we're all in this together. This is not one entity's problem alone to solve. We have to do this collectively, is thinking about the practical notion of the status quo, right? So there's strong incentives in many ways to keep the status quo, and perhaps no one knows this better than I, because whenever we make a policy decision at NIH, inevitably you're shifting the status quo, you're goring someone's ox, and you tend to hear from the people whose ox has been gored. And so we need to think, how do we make sure that we have sort of the balanced voice of all of us who care very strongly about improving the system, and thinking about how do we thoughtfully do those cultural shifts without setting ourselves back. So what has NIH been doing about sort of moving the needle on this and solving some of these problems? Just want to give a brief sort of whirl through some of the policies that we've put into place or things we're thinking about. Certainly clinical trials, results reporting, and an entire suite of policies related to improvement of clinical trials, the soup to nuts approach that you really need in terms of both improving rigor and replicability and introducing transparency in the system, which starts, in our case, from solicitation of the trial. We've expanded dramatically the definition of a clinical trial, not popular in some circles, but certainly with the intent that we wanted to make sure that we were doing studies involving human volunteers, that they were of the highest quality, and that ultimately all of these pieces from the initial study design all the way through reporting of results was as transparent as possible. Similarly, when we think about sort of the ends of the research pipeline, we want to make sure that we are incentivizing and enabling responsible data sharing. And so we are moving rapidly into the space of thinking beyond just genomic data or data associated with individual projects like the cancer moonshot, for example, or what we've done in the clinical trial space, to thinking about our entire data ecosystem and how do we ensure that that is shared in a responsible manner, again, to help introduce some transparency into this system. And so we have been very much moving the direction, as Alexa noted, of requiring researchers to tell us how are they going to manage and share their data responsibly, and thinking of ways how we can both assess that up front in making funding decisions, but also in thinking about how do we hold people accountable, because it's very easy to give rhetoric to the, of course I'll share my data and I'll do it in the best possible way for science, but when push comes to shove, are people actually doing that? Are they actually being responsible? And we want to make sure that we put the appropriate carrots and sticks in place to make that happen. And I found the pyramid that Brian presented very interesting, because one of the things I think about all the time is the push-pull relationship between the top of that period and the bottom of that pyramid, because I absolutely agree that you need to have the infrastructure in place to facilitate the implementation of policy, but sometimes there's a strong disincentive to build that infrastructure until you have the shove of the policy, and then suddenly people think, oh, I have to comply with this, so I better start putting the tools in place to make sure that happens. So I think about that relationship quite a lot, and what the appropriate timing of those two are. And this is just in the spirit of transparency to say that NIH is going to be putting out our draft policy very soon, hopefully within the next month or so, and we're really looking to solicit comments from the community about whether or not we've gotten this right, and that sort of push-pull relationship between policy and the infrastructure needed to make this policy a reality. So stay tuned and please weigh in. Of course, we've also focused a lot of effort in recent years on rigor and reproducibility, trying to solve this very clear problem of, are we in fact sure that scientists are doing the very best science? Are we assured that they are bringing the highest quality rigorous standards to the table, and that in fact we have a system that facilitates reproducibility? I actually have to say I am glad that the language is starting to change away from reproducibility to more of an emphasis on transparency, because truthfully, biology is messy, right? There's all sorts of reasons why a biological experiment might not be reproducible, and those reasons might be super interesting, in fact, for the next scientific discovery or the next scientific question, but we are never going to be able to tease that out from just sloppy science if the soup to nuts process is in fact not transparent, and that really speaks to some of the issues that Jaromir brought to the fore. If you are on the ground trying to replicate an experiment or demonstrate reproducible results, it's really hard to tease apart, well, have I discovered something interesting here, or in fact do I just not have the information I need to do this in a rigorous way? So we've been making strides and picking away at the rigor front in particular, whether it's sex as a biological variable and an emphasis on that in experimental design, to what I just mentioned we're doing in sort of the clinical trial space. But we've recently announced that we are sort of next mountain to climb in the rigor and reproducibility space is related to enhancing reproducibility and rigor in animal research. A huge amount of our funding goes to investment in experiments involving animal models, which are incredibly important to advancing our understanding of biology and seeking new treatments for human diseases. But there is and has been for quite a long time a lot of evidence suggesting that there is a great deal of room for improvement in both the rigor of experimental design in experiments involving animals, as well as the transparency to allow us to really explore what are the most rigorous experimental designs and best animal models. And I think sometimes, when you bring up sort of the concepts of rigor and transparency and animal models, people automatically go to, are we talking about power equations here, an appropriately powered experiment? Yes, but that, I would argue, is necessary but insufficient, because it gets into other questions, as well as, I think, Jaromir, you mentioned, am I using the right animal model? That is a big question, and it gets back fully to this loop of, we assume scientists do good science, and so if there has been a large number of papers published on a given animal model, there's a cottage industry of scientists who developed and used and have done their research for a long time in that animal model, it is very difficult to suddenly say, you know what? In fact, that animal model might not be very good at all. Not very good because maybe it's not giving you the right answers to the questions you're trying to ask, or not very good because maybe it's not a good model of human disease for any number of reasons. But the system is very loath to ask those questions in a very rigorous way. And so that is a huge cultural phenomenon that serves as a barrier to addressing some of these issues. And transparency is in service of raising those questions, because a lot of times, the way this conversation plays out in the real world, a question is raised. Who do you go to? You go to the subject matter experts who have a little bit of a stake in the system, and they say, oh, no, it's fine. But there's no objective evidence out there to really point the finger and say, well, maybe that's not the best. So as with many sticky wicket issues, NIH has tossed this ball to our advisory committee, to the directors, so we can really bring in expertise and try to tackle this issue in a very real way. And it is all in the spirit of continuing to do better and continuous improvement of our entire enterprise. So with that, I'm really looking forward to the conversation, and thank you for your attention.